Most of our patients, when they consider facial feminization surgery, especially if they've never had surgery, there's no boundaries in your thoughts on what the extent of pain is going to be, what the extent of bruising is going to be. There's nothing that they can associate it with. So unfortunately, fear of surgery, of hospitals, it tends to just give patients so much options to take it to levels that really will not happen. Unfortunately, I think the internet sometimes is a disservice, because some people, honestly, they could be the screamers if you just take a little pin and you just dab them, or a mosquito bite and they're screaming, but they then relay this information on the internet, which was their interpretation. So someone reads it who's never had surgery, who really doesn't know what to expect. It even brings more fear to them. And unfortunately, I think the situation and the journey, life journey, that our trans women, they come to terms with everything, and it's like, okay, I'm still going to do it. So now their fear has been heightened. Just everything, the unknown. So they come in here just brave. They're, I'm ready, and just really putting their best foot forward,
Yeah.
all their strength. And what's so lovely is that day they are afraid. The following 2 days from surgery, they're wiped out. I mean, fact is fact. God forbid if this were, let's say, an automobile accident and you had the exact same fractures, you would be in intensive care easily for a month before you're even brought to a regular room. That's how much we reconfigure the face, and all the cuts we make between the cuts here, the cuts there, the nose, and if that was not controlled by a surgeon, let's say a windshield, that patient would be in ICU. Absolutely, for a long time. But because it is controlled, patients are always amazed that by the 5th day, like this lady, for example, by the 5th day she was applying makeup, she was going out, she was socializing, and I even think you were doing some shopping, if I remember. Because you used to come to the, just to check in with us, like, okay, I did this, and this, and it's like, okay, we'll see you back in a few days. So usually by the 5th day, patients feel so much better about themselves, and a lot of that fear is removed from them. Comfort starts to come back, and then those little angels, they walk around passing, the good news of, I don't want to go through this again, but it's not as bad. Yeah, it's not as bad as I thought it would be. Now, what BB did have, though, and she did have extensive surgery, she had her scalp advanced, meaning repositioning the hairline. You're bringing the hairline forward, but also with that procedure, you're shortening the length of the forehead. So she did have the scalp advancement. She did have everything pertaining to the forehead surgery, implying the middle part of the bony work, the orbital part of the bony work, because you do have to feather out, to, of course, have the continuity of the change. She did have that, and she had a brow lift. So, the brows were nicely lifted. She had her nose done. Her upper lip was reduced, meaning the skin was reduced. That was one, but she also had the augmentation, which is, we used a dermis from the scalp advancement, and Dr. Ostrow tunneled from the corner of the mouth, basically the upper lip, and then he just weaved the dermis through. Top and bottom, pardon me. She had upper and lower augmentation. And she had her chin and her jaw done. And this we just revised because we didn't do that.
No.
Yeah,
You
yeah.
corrected somebody's
Correct.
mistake.
So that, and I didn't say it for that reason. Just it's like, I remember we revised the scar.
Right.
Yeah, yeah.
It was very bad.
Yeah,
It was
because
very
we did
bad.
revise it. So we revised the incision site that she had from previous.
So then you clipped the muscle.
Oh yeah, we clipped her muscles in here too, so she wouldn't have to rely on Botox for the rest of her life. Yeah, while you're in there, why not?
Yeah,
Just
quick.
get it done and out of the way.
It's great.
So that was done 6 months ago. Technically, the reason why we're seeing BB today is the surgery that she had undergone 6 months ago. All the swelling really takes a good 3 to 4 months to leave her face. And when you're considering, as BB is right now, soft tissue work, meaning a facelift, you need to make sure that all that swelling is gone so the doctor then can approximate the tightness and give her truly a good facelift. If there was any swelling in there, that would, sort of compensate, and then let's say 6 months later, she might notice some sagging and things and not be all too pleased with us. So we want a patient to wait at least 6 months just to assure that everything is done. And that's what she did. So she's back for the soft tissue work, which consists of a facelift and little touch-ups here and there of our previous surgery. Do you have any comments about
Well,
that?
I just remember,
Okay.
hi, you can cut that out. I was concerned about the surgery before I had it. More so, I guess, more concerned about, well, I hope everything goes all right and I come out all right. God, I really want to be beautiful and pretty, and I hope everything goes all right. I didn't put any thought into the pain, and it's there, no kidding about it, and the recovery time. And I thought the anesthesia would never get out of my system, but it takes a few days.
Right,
It does.
it
I mean,
does.
because you're in there so long, and mine was 11 plus hours.
Right.
So that's a lot of anesthesia to take, and had a weird effect from the Percocet.
Right.
Really screwed up my dreams, so that helped me get off the Percocet real
Right.
quick. And I just used
You were using Tylenol.
Tylenol. Yeah, I went back, and it wasn't hard. Went down to Tylenol. Eating was a little difficult for a while. First of all, you weren't too crazy about eating, and then little by little, you could work your way up to more and more meals. I think I lost close to 10 pounds during recovery, and then put it back on, got chastised by somebody here, and I did lose it again, and another 10 pounds. You want to get your weight down as low as you can before the facelift because you want to get a better effect. So I lost another 10 pounds.
Exactly. Proud of you for that, because now you can gain it after the
Afterwards.
facelift.
And
But
that'll
not,
make it
yeah.
better, yeah.
Yeah.
I have a lot less trepidation this time because now I know what I'm in for. I understand the recovery a whole lot better, and I know it won't be near as severe. And I have to tell you, there's times like, well, do you really want to go back and spend more money? And I took the attitude that if I didn't, a lot of what I spent already would have been wasted. So you have to put the thought of the money aside for the benefits. And I figured it's worth spending the money to get to the full effect. And without doing it, I never would see the full effect.
Yeah.
So, yeah, money.
And I agree with you. I feel, money, it's good, but on the other hand, money is supposed to bring you happiness.
Yeah.
So if this is bringing you happiness, honey,
Yes.
and